So we're going to shift gears a little bit, and to keep with the theme that was chosen for this year's meeting, which is transformation and celebration, we're going to celebrate some of the best contributions as Paper of the Year. These papers were rigorously vetted by the subsections and the editors at the journal, and they were selected for presentation here. So the first paper is going to be in the Cerebrovascular section, and it is Cerebral Revascularization for Aneurysms in the flow diverting era, and I'd like to call Dr. Harley, Brito, de Silva to come up and present his paper and accept your award.
So I'd like to thank on behalf of all the authors of the paper and of the University of Washington, the Department of Neurological Surgery, for the subsection of cerebrovascular of the CNS for this award for this paper, Cerebral Revascularization of Aneurysms in the Flow Diverter Era. So in the next 4.5 minutes, I hope to present some of the data and not embarrassing too much the language of Shakespeare. So let's move to the next slide then. So even with advances of endovascular neurosurgery, there's still a certain group of patients who have a difficulty in obtaining optimal treatment, and on this slide, we have the current indications for bypasses, and we can see that large and giant aneurysm and fusiform shape, excessive thrombosis, these are still difficult cases for endovascular treatment. So when we looked at all these current indications for bypasses, we're interested to see how the advent of flow diversion stents had impacted the applications of outcomes of cerebral bypasses in the treatment of intracranial aneurysms. So Harborville Medical Center, the data from 2005 to 2011, we see that clipping and coiling are in both eras are still the most frequent types of options for the patients. The table on the right, shows the number of cases needing cerebral bypass. These are the numbers in red, and the numbers in red show a slight decrease in comparison to the pre-FD era. So on this slide, we looked at the aneurysms characteristics in both era groups, and we see that although they're mostly similar, there are some small differences. For instance, we see there's an increase on the posterior circulation types of aneurysms, and we see that now pipeline also appears as one of the reasons, as one of the treatment types for the cases that are being submitted to bypasses. Otherwise, most of the data is similar. But the most interesting thing that we were able to find was the aspect of the functional status. Functional status is different in the pre-flow diverter era in comparison to the post-flow diverter era. Patients now are in worse condition before surgery, and their recovery is worse, and therefore also their post-operative modified ranking scale scores are also worse. So table 4 summarizes the surgical outcomes for the bypasses now. We see there's basically almost no difference in the pre-FD era to the post-FD era. So most of the complications are around 24 to 27% of the cases. Bypass, patents, and aneurysm occlusion has not changed in both eras. And to finalize, we would just like to present one of the examples that we gave in our paper of a case needing a bypass. This is the images of the patient before the pipeline with a giant MCA aneurysm. There's an image of during the pipeline device implantation, the post-pipeline to the top right showing still some blood flow. The patient was readmitted in the emergency room with a great brain shift and herniation. This is the artistic illustration of the bypass procedure and the post-bypass image on the top, on the lower right corner. So finally, for time's sake, I'll jump directly to the right column when you see that we summarize that bypass are now being performed on patients who are in worse condition than the pre-FDS group. Pipeline are being performed in patients with failed pipeline or in ineligible patients, a greater number of posterior circulation patients, and the results and complications of post-FDS bypasses are similar to the bypass pre-FDS group. Thank you so much.